Okay, continuing our discussion, we will go now to communication. When it comes to communication, there is what we call interprofessional healthcare team. So the transcultural interprofessional healthcare team has as its core the client, or what we call the raison d'être. This is a French word. Ibig sabihin nito, the reason for being, di ba? Ang bongga ng term na yon. The reason for being, ibig sabihin, bakit ka naging nurse? Dahil merong pasyente. Bakit ka naging nurse? Dahil merong client, di ba? Kasi kung wala naman tayong future clients, hindi naman tayo magiging nurse. So the reason for being, according to Transcultural Interprofessional Healthcare, is the client. So in addition to the client, the team of the Transcultural Interprofessional Healthcare team, we also have one or more of the following members. We have the client's family, number one yan. The client's family and other significant in his or her life, including a legally appointed guardian who might not be genetically related. For example, when you go to as a bedside nurse, no? Kapag ikaw ay nagpunta naman sa room, hindi naman lahat ng tanong mo ang sasagot client, tama? Hindi lahat ng tanong mo pasyente ang sumasagot. Minsan or kadalasan, mas sumasagot pa yung nanay, yung bantay, tama ba? Dahil titingnan din natin yung welfare ng ating client, tinitingnan din nila, wini-weigh din nila, ano ba yung magiging desisyon ng aking family. So, ang isa kasama natin, i-include natin, kasama natin sa team ng ating client is the client's family. We also have credentialed health professionals such as andito tayo. Bakit nandito? Credentialed health professionals. Dahil sa susunod na slide, meron ding mga health professionals with no credentials. But here, under this, we have the physicians, the physical, occupational, respiratory, music, art, dance, recreational, and other healthcare professionals. We also have the folk and indigenous or traditional healers. Meron pa rin kasi, di ba nabanggit natin, meron mga communities na they still believe sa mga albularyo, sa magtatawas, sa mga pahid ni lola, ni lolo. Meron pa rin silang mga ganong katuruan at kailangan din i-consider natin as a transcultural nurse, ano ba yung mga paniniwala ng client ko na to na pwedeng maka-interfere or pwedeng makapabilis ng kanyang paggaling, ng kanyang recovery. We also have, aside sa mga traditional healers, we also have religious or spiritual healers. Pwede kasing meron silang mga pinanggalingan na iba't ibang relihiyon or meron silang pinanggalingan na iba't ibang paniniwala. We also have clergy or lay members of religious groups who heal through prayer. Kaya mapapansin mo sa mga ICU or hindi ko lang alam ngayon, pero sa amin kasi yung team din namin sa church, meron pa rin na pumupunta sa mga ospital at nag-offer kami ng prayer. Mapapansin mo, meron na mga offices or mga rooms, I should say, na tinatanong nila yung mga nursing department, tinatanong nila yung mga clients na medyo critical na, ma'am, gusto niyo po bang magpatawag ng pare or magpatawag ng pastor or magpatawag ng ministro? So, i-consider din natin kasi meron din silang mga paniniwala who heal through prayer, religious or spiritual rituals, faith healing practices, and related actions or interventions. For example, there are priests, there are priestesses, elders, rabbis, imams, monks, and other spiritual healers. We also have others. Meron ding others. Others identified by the client as significant to his or her health, well-being, or healing. Pansinin nyo to, such as companion animals. Meron pala na talagang mga patient din, mga client, na kinoconsider nila ang kanilang paggaling kung meron silang kasamang aso, meron silang kasama may pet nila. So marami tayo talagang i-consider na talagang magiging as a transcultural nurse, ang isa na ma-activate mo dito ay yung pagiging open-minded, no? Hindi lang sa networking, pero dito din sa ating nursing care, magiging open-minded tayo. Wow, meron pala siyang mga ganitong paniniwala na Ayan, meron siyang companion animals. 'Di ba merong mga sa rehabilitation, meron ding mga recovery pets na pinapabilis ang paggaling. Pansinin daw kasi ang isang tao na according to research, I think parang 30 days. For 30 days, pwedeng walang, tama ba? Pwedeng walang food or 100 days. Hanapin ko na lang research na ulit na yun. Parang for 100 days, ganito yung concept niya. For 100 days, pwedeng walang food ang isang tao. For 30 days, pwedeng walang water. But for 1 day, hindi mabubuhay ang isang tao kung walang pag-asa. And minsan, ang mga tao, ang hugot ng kanilang pag-asa ay kung meron silang mga pets. Meron kasi na ako, may kakilala ko personally, meron kaming tita na hindi siya nagkaanak, pero ang kino-consider niyang anak ay ang kanilang aso. Talagang ano yun, pinsan namin yun. binibilan niya ng lahat ng pwedeng ibili sa unika-iha, no? Nag-birthday pa nga ng isang araw, pa-Jollibee party pa. Pinadalang kami ng Jollibee dahil birthday daw nung pinsan naming aso. 'Di ba? Merong mga ganon, companion animals. Okay, according to WHO, can somebody read this this paragraph? Yeah.
Ako na lang po. The World Health Organization defines interprofessional collaboration as multiple health workers from different professional backgrounds working together with patients, families, caregivers, and communities to deliver the highest quality of care.
Okay, thank you. So according to WHO, kailangan talaga ng merong interprofessional collaboration for us to give culturally congruent care. Hindi kaya ng nurse lang. Agree ba kayo doon? Hindi kaya na tayo lang nurse ang nakakaintindi sa kanila. Dapat yung buong team nagkakaintindihan. Kaya nga meron tayong tinatawag din na mutual understanding. Meron ding mutual goal setting na tinatawag dito. So communication is derived from the Latin verb communicare, meaning to share. Communication refers to the meaningful exchange of information between one or more participants. Take note of this, no? Communication refers to meaningful exchange. Bakit meaningful exchange? Kasi there are exchanges na hindi meaningful. Anong ibig sabihin nun? Parang padilim na ako ng padilim dito. Merong mga hindi naman sinasabi, ma'am, ano nung oras na po ba dyan? Parang dilim naman kasi dito sa kwarto ko. No? Merong mga exchanges na tinatawag natin na, sige, ganito na lang. Anong pinagkaiba ng dialogue at ng monologue? Meron ba kayong idea? Bukod sa spelling, anong pinagkaiba ng dialogue at ng monologue? Siguro nung high school kayo, nakapag-monologue kayo, no? Nakapag sabayang pagbigkas. Anong pinagkaiba ng monologue at ng dialogue? Sige nga, pwedeng magsalita or kaya pwede kayo mag-chat sa tingin nyo. Kasi pinag-aaralan natin communication. They are both forms of communication but they are different. What is the difference between a monologue and a dialogue? Habang inaayos ko yung, ayun, di ba? Nakita niyo na ako ng maliwanag. Wala kang idea. So, ibig sabihin ng mono means one. Di means two. I forgot if it's a Greek word or Latin. Pero ibig sabihin ng mono is one. Diba? Kaya nga, monologue, it means ikaw lang yung nagsasalita. Pag dialogue, merong dalawa yung nagsasalita. So, a communication, pag sinabi nating meaningful exchange, may nagsasalita, may nakikinig. Minsan kasi merong communication na isa lang ang nagsasalita or parehas nagsasalita, walang nakikinig. Or nagsasalita pa lang si client, ikaw iniisip mo na ano kaya yung ire-reply ko dito. Hindi mo pa naririnig yung buong statement niya, pero meron ka ng automatic response, 'di ba? Para kang chatbot na, no? Yung parang merong nagte-text pa lang pero meron ka ng reply. So a communication to be meaningful, it has to be two-sided, hindi pwedeng one-sided lang. So the information exchanged may be conveyed through ideas, feelings, intentions, attitudes, expectations, perceptions, instructions, or commands. Communication is an organized pattern system of behavior that makes all nurse-client interactions possible. Bakit nagiging posible na maging maayos? 'Di ba? Meron tayong kasabihan mga Pilipino na kung kayang madaan sa maayos na usapan. Tama? Kasi meron tayo, tinitingnan natin palagi, kung kaya namang pag-usapan, bakit maghahablahan pa? Bakit pa pupunta pa tayo sa korte? Bakit pa ganyan? 'Di ba? So ibig sabihin, ang communication talaga is very important. Communication is an organized patterned system of behavior that makes all nurse-client interactions possible. It is the exchange of messages and the creation of meaning, according to Munoz and Lachman of 2008. Because communication and culture are acquired simultaneously, they are integrally linked. Magkadugtong ang culture at ang communication. For example, meron pala na nababother pala ako kapag for example, kapag ang nurse pala na laging bumibisita sa akin ay lagi akong tinatanong na, kamusta ka na ma'am? Kamusta ka na yan? Yung culture ko pala ay ayaw ko na lagi akong tinatanong ng personal. Imbes na matuwa ako, maiinis pa ako. So, para maging culturally congruent ang care na tinatawag, meron dapat interaction, merong communication na you have to be open na sabihin mo, this bothers me or this offends me. This is something that I do not want. Do you get me? So in effective communication, there is mutual understanding of the meaning. Communication, again, is an exchange of messages and the creation of meaning. Kapag walang nagiging meaning, hindi yun communication. Ibig sabihin, kung walang naging maayos na usapan, there is no communication. Para lang kayong nag-exchange ng para lang nag-rant, no? Pero walang naging communication. Ineffective communication, there is mutual understanding. Inulit ko yan, of the meaning attached to the messages. Let us look at this framework. Yan. Pag meron kayong nakita mga ganito na may mga drawing, mga diagram, ang ibig sabihin yan, ang tawag dyan ay framework, no? Meron mga iba't ibang frameworks na tinatawag. So here, makikita natin that the client is the center of the universe of the nurse, no? The cross-cultural communication among members of the interprofessional healthcare team, ito yon, clients, family, significant others, credentialed health professionals, and folk, traditional, religious, and spiritual leaders. Makikita mo yung ito yung health-related values, attitudes, beliefs, and practices of a client. Bakit siya nabuo? Because of this one. Kaya makikita mo, sa framework, may mga ibig sabihin kasi yung mga araw na yan. Ang ibig sabihin itong araw na pababa na to, ibig sabihin, ito yung influencers. Kumbaga tayo ay mga, hindi lang, di ba, sa social media, merong influencer. Tayo pala, or ang client pala, may iba't iba siyang mga influencers. Ito yung mga influencers niya. Okay? And then this one, itong dotted na parang arrow, ibig sabihin yan, yung communication. Communication between this, and this. Ang communication pwedeng verbal and non-verbal. Meron tayong tinatawag na language. Kaya nga meron ding mga language barrier, tama? Ang language barrier, for example, natawa ako. One time pumunta kami ng Cebu, tapos sabi nung isang friend namin doon, meron siyang joke, dahil pumunta daw sila ng mall, paano na nga joke na yan? Pero totoong buhay siya eh. Pumunta daw sila ng mall at sabi nung nanay na taga Cebu, sabi niya doon sa, nakalimutan ko yung kwento. Ang word ay maglilibang. Sa atin, sa Tagalog, pag sinabi maglilibang, ano ibig sabihin na maglilibang? Mag-entertain, amusement, di ba? Parang lilibot. Ngayon, sa Cebu pala, meron palang certain na language sila, na dialect. Ang ibig sabihin pala na maglilibang ay magdudumi, magbabawas, magto-toilet. So akala ng bata, ay pupunta kami ng mall kasi kami ay maglilibot. Yon, maglilibot. Akala niya maglilibot. So ang term pala ng maglilibang ay magdudumi or magto-toilet, mag-oo. So magkaroon na ng miscommunication. So yun yung tinatawag natin na language barrier. Greetings, verbal and non-verbal, we also have their greetings, silence. There are cultures na kapag nag-good morning ka, hindi sila mag-good morning back kasi ang silence sa kanila, yun na yung nila, yun na ang kanilang way of, kumbaga, communicating. Meron naman na pag nag-aloha ka, ang aloha nila ay aloha din. Sabihin yung good morning nila or yung hello nila, the same word ng goodbye. There are cultures na ayaw nila ng may eye contact and facial expressions. There are gestures, posture, time. Pag sinabing time, yung chronemics, for example, there was a time na nung nagturo ako sa Vietnam, ang usapan ay 1 o'clock. So nandun ako syempre kasi ayoko naman lagi ko siyang iniisip na kapag nalaman nila na ako'y Pilipino at na late ako, iisipin nila ay Filipino time. May time difference kasi ang Vietnam at ang Philippines. Merong 1 hour na difference. So mas nauuna tayo ng 1 hour. So for example, 12 o'clock doon, dumating yung kausap ko ng 3 o'clock. Tapos ang sinabi, ma'am, because this is Vietnamese time. So sa kanila pala, ang Vietnamese time mas malate pa sa Filipino time. Sobra silang late makipag-usap. Kaya nakakainis. Kung hindi mo gets yung ganung culture nila na hintayan, alam mo yung kung kailan dumating, dun sila makikipag-usap, maiinis ka. So as a nurse pala, kasama din itong tinitingnan natin, proxemics or the distance. Ang nature ba ng client natin, do they want a face-to-face na pag-uusap or do they want a personal space na ibibigay mo sa kanya? Modesty, for example, like this one, the picture here. This female is wearing a hijab, no? She is wearing a modest dress na hindi makikita. For example, when we were planning to go to Egypt, pinaghanda na kami na magdala ng maraming mga scarf, magdala ng mga blouse na talagang mako-cover yung puwitan. Hindi pwede kasi na makikita yung curve ng puwet mo. Kailangan mahaba yung damit na isusuot mo. Kailangan hanggang parang above the knee. Kasi sa kanila, yun ang kanilang modesty, touch, technology-assisted, literature, art, music, and dance. So this framework, pinapakita lang na ang client pala, mayroong mga iba't ibang mga way of communicating with the traditional, with these factors, these influences, kaya nagkakaroon ng health-related values, attitudes, and beliefs and practices ang isang client. Diba? Ang dami nating i-consider. I-consider mo ang environmental, social context, wala pa dito, political context. For example, nalaman mo, ay ito pala ay kampo ni ganito. Tapos ikaw for example, ikaw, ang binoto mo si Duterte, ito, ang binoto pala niya, is ganito. Mako-compromise ba ang pagbibigay mo ng care or hindi? Kasi makikita din yan, Okay. Whereas language refers to what is said, para-language refers to how it is said. Okay, language is what is said, yung words, no? But para-language, pag sinabi nating para-language, highlight nga natin yan. Para-language refers to how. Di ba minsan meron kang sasabihin na it's not what you say, it's how you say it. Meron tayong ganon. Para-language, ang isang example niyan, for example, refers to how it is said and relates to all aspects of the voice that are not part of the verbal message. Para-language may modify or nuance meaning or convey emotion through rhythm, pitch, stress, volume, speed, hesitations, or intonation. For example, look at this slide. Yan. Sige, can somebody read the slide? Sige, isa. Can one person, read this?
Ako, ma'am.
Sige.
I would like to help you.
Okay. Sige, sabi mo, I would like to help you. Now, ang gusto kong ang gusto ko namang i-stress ninyo ay itong word na to. Di ba, nung binasa mo siya, I would like to help you. Isang tone lang. Now, kapag binasa mo siya, lagyan mo siya ng stress dito sa you. Sige nga, si Ryugi ba yun? Nasasabi ba siya kanina? Nagtataas ba siya ng kamay?
Yes po, ma'am.
Sige nga, basahin mo nga siya na ang stress ay nandito sa you. Gets mo ba? I would like to help you.
I would like to help you.
Yan. Ngayon, naiba yung meaning, di ba? Ngayon naman, tanggalin natin yung you. Gawin mo naman na ang lalagyan mo naman ng stress ay yung I. Sige.
I.
Sige, tingnan natin si Monica.
Ay, wait lang. I would like to help you.
Okay, ganito yan, di ba? Pag sinabi mong stress, yung parang lalagyan mo ng diin, I would like to help you. Nakita nyo yung pinagkaiba? Yung una, nung binasa ni
Yes, po.
I would like to help you, parang magalang. Nung sumunod naman, I would like to help you. Parang meron siyang pagbabanta. Ngayon naman, nung sinabi kong I would like to help you, nakita nyo yung pagkakaiba? That is what we call
Yes, ma'am.
paralanguage. Na naiiba yung meaning dahil sa pagde-deliver natin. Kaya we have to be careful with this kasi paralanguage again is what is the difference between language and paralanguage? Language is what is said, yun yung I would like to help you. Pwedeng I would like to help you. 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 May iba yung meaning. Do you get me? So, yun ang pinagkaiba ng communication. Non-verbal naman, communication refers to how people convey meaning without words. Ito naman yung, of course, from the word itself, non-verbal, sabihin, walang words. Through the use of facial expressions, gestures, posture, and the physical distance between the communicators. Pwede mong sabihin, ma'am, di ko po kaya yung facial expression kasi meron akong resting B face. Di ba? Yung talagang kahit na wala pa akong ginagawa, mukha na akong masungit. Di ba? Wala pa akong ginagawa, may naiinis na sa akin kasi akala nila lagi akong galit. Merong mga ganung talagang mukha, kaso kailangan iisipin natin din how do we communicate with our nonverbal communications. Aspects of communication that are of particular importance for the transcultural nurse include language, the use of interpreters, greetings, silence, eye contact, facial expressions, gestures. These are all here. Now we are to check natin itong, ayan. Kasi may mga times pala na kakailanganin natin ng interpreter. I don't know kung nakalimutan ko kasi kung anong episode yun sa Grey's Anatomy. Meron sila doon na isang episode na merong isang parang Chinese na national, tapos hindi nila magets, hindi nila malaman kung ano ang gustong mangyari dahil walang kayang makapagsalita ng Chinese, walang makaintindi sa kanya. Now, yung time naman na yun, dahil nakita niya si Dr. Yang, si Christina Yang, akala niya in-check din. Pero si Dr. Yang pala ay siya pala ay Korean pero wala siyang background ng language. So yung client nag-expect na maiintindihan sila. So what to do when there is no interpreter? So here are some points that we have to do when there is no interpreter. Sige. Babasa tayo isa-isa. Tuloy na lang tayo. Sunod-sunod na lang. 1, 2, 3, 4, 5, 6. Hindi nyo pala nakita yung 8, 9, 10, 11, 12, 13, 14, 15. Wow, dami natin babasahin. Sige. Okay, number 1. Sino yung number 1 reader? Sige, si Mark.
Be polite and formal.
Sige, tuloy-tuloy na lang tayo. Hindi ko na kayo makikita pala sino pa yung si Mark, si Mitch, si Carl, si Micaela, si Cindy, si Monica. Sige.
Greet the
Basa.
person using the last or complete name. Gesture to yourself and say your name. Offer a handshake or nod. Smile.
Proceed in an unhurried manner and pay attention to any effort by the patient or family to communicate.
Speaking at a moderate voice, avoid talking loudly. There is often a tendency to raise the volume and pitch of your voice when the listener appears not to understand, but this may lead the listener to perceive that the nurse is shouting or angry.
Okay, dito muna tayo. Pause muna tayo sa sa reading comprehension natin, guys. Thank you sa mga nagbasa. Okay, meron tayo dito highlight kasi usually ito yung nangyayari sa isang setup na hindi nagkakaintindihan. Akala natin kapag nilakas natin yung boses natin, may intindihan na nung kausap natin. For example, 'di ba? You know English? House. This, ginagawa natin siyang para bang ginagawa nating retarded hindi na nga kayo magkaintindihan, ilalakas mo pa. So here, you have to speak in a low, moderate voice. Kung ano lang din yung talagang talking voice mo, yung moderate na voice or pitch ng iyong boses, yun lang din. Avoid talking loudly. There is often a tendency to raise the volume and pitch of your voice when the listener appears not to understand. Feeling natin, mas naiintindihan nila kapag nilakas natin. Hindi nga nila maintindihan. But this may lead to the listener to perceive that the nurse is shouting or angry. Nandito on number 1, what is number 1 that is said? Be polite and formal. What if you were on his shoes, na hindi niya masabi po ano yung gusto niyang sabihin, meron na ngang masakit sa kanya at hindi pa kayo magkaintindihan. What if you are on his side? Ano kaya mararamdaman mo nun? Hindi ka maintindihan ng healthcare giver. So we have to be always polite and formal. Let us go now here. Sige, tuloy na tayo dito. Yan.
Use any words known in the patient's language. This indicates that the nurse is aware of and respects the client's culture.
Next.
Mama ko po ba yung tinawag niyo kanina?
Sige. Sige, tuloy tayo.
Use simple words such as pain instead of discomfort. Avoid medical jargon, idioms, and slang. Avoid using contractions. Use nouns repeatedly instead of pronouns. And for example, do not say he has been picking his mamputol na.
Sige, okay na yon. Thank you. Dito muna tayo. Okay. Use any words known in the patient's language. So, for example, at least kung meron kang background sana para makausap din natin yung patient natin. Use simple words such as pain instead of discomfort. Meron kasing mga medical jargons na tinatawag na hindi na nga niya maintindihan tapos yun pa yung gagawin natin. For example, ma'am, kailan po yung LMP po ninyo? LMP, last menstrual period. Manong sabihin mo na, ma'am, kailan po yung unang patak ng inyong huling regla? Gets nyo? So, ilalagay mo siya sa... Sino yung mute muna natin. Yan, okay. So, gagawin natin, aabutin natin ng ating clients. Use nouns repeatedly instead of pronouns. Let's go to here. Sino yung si Carl? Carl, tapos Monica, tapos sino pa ba yung kanina? Sige, tuloy na natin yan. Sige, yung mga nag-raise ng hands, si Sofia, si Patricia, tsaka si Christian. Sige, tuloy na natin ito.
Give instructions in the proper sequence. For example, do not say before you rinse the bottle, sterilize it. Do say first, wash the bottle. Second, rinse the bottle.
Okay, dun muna pala tayo. Sorry. Give instructions in the proper sequence. For example, do not say before you rinse. Gagawin nyo lang siyang parang step by step, no? Dahil hindi na nga tayo magkaintindihan, para hindi malito, gagawin nating mas simple. Gets ba yun? Tawag dito. Imbes na sasabihin natin before, bago mo hugasan, ay sterilize mo, gawin mo na siyang step by step. Una, hugasan. Pangalawa, sterilize. So, mas pinapasimple natin. Next tayo dito.
Discuss one topic at a time. Avoid using conjunctions. For example, do not say, "Are you cold and in pain?" Do say, "Are you cold?" while pantomiming. "Are you in pain?"
Yes, okay. Thank you. Dito, wag nating pagsasamahin. Ang gusto ba nating malaman, masakit ba yung tiyan niya? Isa-isa lang ang tanong. Masakit po ba yung tiyan nyo at ulo nyo? So nalito na siya, ano ba doon yung tinatanong mo? So isa-isa lang ang tanong. So yun lang yung ano nito. Yun lang ang meaning nito. Next, dito tayo. Validate.
Validate whether the client understand by having him or her repeated instructions, demonstrate the procedure, or act out the meaning.
Okay. Ang susunod nating mga readers ay si Sofia, si Victor, si Angelica, at si Christian. Sige, tapusin na natin.
Write out several short sentences in English and determine the person's ability to read them.
Basahin na po ba, ma'am?
Sige, game. Basahin na natin.
Try a third language. Many Southeast Asians speak French. European often know 3 or 4 languages, or try Latin words or phrases.
Ask if any of the client's family and friends could serve as an interpreter.
Hindi ko nakuha yung buo. Pero nasa book natin yun eh. Obtain free books from a library. Kung papansinin nyo na parang, ma'am, ang dami naman pong trabaho namin, nag-interpreter pa po kami. So, welcome po sa trabaho po ng mga transcultural nurse. Hindi naman everyday ay may ma-encounter kang ganito. Do you get me, class? Kasi baka sabihin mo, ma'am, ang dami naman pong trabaho, meron na nga po kami ina-assist na ganito, tapos mag-research pa po kami sa library. Not all the time naman. It's not every day that you will encounter clients like this one. These are special cases. But sa mga special na pagkakataon nga na yun, that is why we have this course for you to be prepared for that certain moment na magkaroon ka ng ganyan na meron pala akong client na ganito. At least, no, you are prepared. If not 100%, at least you are prepared enough na, ay, na-encounter ko to sa class namin na I have to be prepared and I have to be knowing at least a little bit of the language of my client. Validate whether the client understands by having him or her repeat instructions. This is very important na pwede mo siyang, di ba ginagawa natin, return demo. Ma'am, pwede niyo po bang ulitin sa akin kung paano po yung paano niyo po hugasan yung bote. Diba? Papakita niya sa'yo, i-return demo niya sa'yo. So, para at least alam mo na kung natutunan ba niyang mabuti yung kanyang, natutunan ba niya kung ano yung sinabi mo. So, yun. Okay. And after that, we also have overcoming language barriers. Dito, nag-highlight na lang ako dito na avoid interpreters from a rival tribe, state, region, or nation. That is why very important na that you are really culturally aware. Yung kinuha mo pa pala, for example, a Palestinian who knows Hebrew may not be the best interpreter for a Jewish client. Baka magkaroon ng World War III doon. So we have to be very careful and very, very culturally sensitive. Be aware of gender differences between interpreter and client. In general, take note of this, the same gender is preferred. So that is overcoming language barriers. And next, meron tayong mga few slides pa we will talk about culturally competent nursing care. But before that, we will have a 10-minute break and balik tayo class. Tapos 5 slide na lang ito and then I will dismiss you. Thank you.
Okay po, ma'am. Thank
Thank
you
you,
po.
ma'am.
Okay po,
Ito
ma'am.
po.
Ma'am.